colocar o nome dela ou só fechar o nome?
Não deixa gravando, não.
Dia no Brasil.
Good morning, good afternoon, everyone. I am Teresa Maria. Continue our project, Innovating Israel and Uberlândia. I call our ambassador in Israel, Mr. Gerson Menandro, to opening our meeting today. Please, Mr., you have the word.
Thank you. Good morning to our friends in Uberlândia, Brazil. Good afternoon to our friends in Israel. It's really a pleasure to participate in one more meeting, dedicated to one of the most important sectors of, I think, not only Brazil and Israel, but the human being in the current times of pandemic we are facing right now. This sector of health, of medicine, is still more important for all of us. Congratulations for all of you that are participating and have the initiative to promote this kind of event. The government of Brazil and Israel are in I think, an unprecedented effort in the convergence of efforts to strengthen bilateral political ties, advance economic partnership, foster initiatives in the fields of medicine, agribusiness, science, technology, and innovation, water management, defense, public security, education, and also increase people-to-people contacts. In our embassy, we have an especially devoted sector to boost and enhance the cooperation and integration of efforts. For this reason, I strongly emphasize the initiative as we have today. Count on Brazilian embassy to facilitate, intermediate, to build bridges, to open doors, as I said, to initiatives like this we have today. I wish a great success of all of you. And again, count on the Brazilian embassy in Israel. Thank you very much.
Thank you. For the welcoming, I call the coordinator of the project, Mr. Rogério Neri, which I give my word.
Thank you, Teresa. Good morning, good afternoon to everyone. And congratulations, first one from the General Gerson Menandro, our ambassador, Coronel Marcos Vinicius, our friend and adido, Regina Viadax, Felipe Campbell, Dana Soares, Silva Brand, and our impresarios here. And good morning, and good afternoon. I will not extend myself, but I would like to highlight the enormous importance that health has gained at this time of pandemic and the need to create value through the use of technology, innovation, and R&D. I would like to emphasize that artificial intelligence, 5G, Internet of the Things, and 3D, plus some of the services that do not yet exist, added to the existing ones, will generate a large-scale evolution. This will be something extraordinary to experience and will promote the creation of new opportunities and solutions. We will connect with greater speed and reliability, improve transmissions, image quality, thus be able to better control patients through super powerful cameras. We will have remote ICUs, rings be able to have better distant treatment conditions and medical qualification. Another example, remote sensors connect to the millions of people through wearable technology such as watches and other devices. Being able to generate reliable information in real time and with precise and predictive analysis, saving lives and thus preserving collective health. There will be no lack of money, technology, and disposition for this team. And in the face of this challenge and so many opportunities, we will have health and the central theme in this conversation today. Thanks to everyone present, and special thanks to the Coronel Marcos Vinicius, who conceived, planned, and has been leading these meetings and bilateral missions. My friend Coronel, thank you. You are our friend now and forever. Goodbye, everyone, and have a nice day.
Thank you, Rogério.
You are.
Okay, as premises. Now we're going to see again just the premises of the projects. Israel Uberlândia. Our premises in this project are, next please. Just a minute. The premises are cooperation, symmetric partnership, mutual gain, and concrete results. You know, just to make sure that's the reason we have this project. So who wants to know more about it and about the other reunion you have, you can go to that land page, ip.aciub.com.br, Uberlândia, Israel. Okay. So our topic today is health. So we will see now the presentation of 6 health companies, which 3 are from Brazil, 3 are from Israel. Each company has 10 minutes to present. Let's begin with Bina, an Israel company. Please, you have the word, Mr. Alan Shane.
Hi, Teresa.
Yes.
My name is Kevin. Vou me apresentar em português, se está bem para você. Então, estou aqui, eu sou desenvolvimento de negócios para a Bina. Está aqui comigo o Avi Markovits, que ele é o manager de desenvolvimento de negócios. E eu vou apresentar a Bina agora. A ideia é falar um pouquinho do que a gente está fazendo e fazer uma pequena demonstração do aplicativo. Vou continuar em inglês, tá bem? Então, this is our team. David Maman founded the company. He's a serial entrepreneur. This is actually his 13th startup. He's our CEO and CPO. He founded the company together with Michael Markson and Konstantin Gedalin. They together account for over 45 years of experience in signal processing, which is the technology, the core technology that allows Bina to measure vital parameters using the camera of the devices that we use in our day-to-day life. We also have Navet Tov, which is our Chief Medical Officer, and Shira Simis, who is our VP Regulatory Affairs and Quality, very important person in the company. And together with them, a strong VP team that has a lot of years of experience. So Teresa, are you putting the slides? Because who is putting the slides? You're on mute. Okay, so Bina was founded in 2016. We have offices in Israel, United States, and Japan. We have over 65 employees, and we have a strong science background with over 15 PhDs. We have more than 100 customers in the world in different industries like health, insurance, and nutrition. Some of them, you might know them here, like Generali in Germany and in some other countries in Europe, Sompo in Japan, Cigna in Korea, and we have many more. And we also got market recognition for our application from these different certifications. So this is how the remote diagnostic tools look nowadays. This is the hardware used today to measure different parameters like oxygen levels, temperature, pressure, etc. And the problem with this, if you can move to the next slide, is that it has a never-ending friction, as we always say, because these are devices that are wearables and they account for a lot of logistic costs and upgrades, and there are other problems including in them. So if you can move to the next slide, please. So what I would like to do now is to show you how our technology works. I would like to share my screen if that's possible. Teresa, I need you to allow me to share the screen. Yes, please. Because we are sharing the screen, I cannot share, so I need to share in order to show my screen for you to see what I want to show you.
Kevin will be providing a live demonstration of Bina's technology once he is able to share his screen.
Yes, please, I need, yeah. I need to share my screen, Teresa, please.
I'd like to share you with the presentation.
He would like to show the application on the screen
Yes,
now.
exactly.
Okay. So, okay.
Possible?
Is it possible, Teresa, to do it? It's going to take 2 minutes tops.
Okay, no problem. You have time to do it.
Thank you.
But I can't share my screen while other participant is sharing. So I need you to stop sharing screen.
Okay, you want to show your screen? Is that it?
Yes. So you're seeing my screen now, right?
Yes.
Great. So this is Bina Team. It's our white label demo app. It's white label because we won't include we are not including the Bina branding when we integrate it to other solutions, to other applications. There are two mechanisms for measuring the vitals. One is using the finger and the other one is using the front camera. The front camera is called RPPG, which is remote photoplethysmography. So I will start measuring my vitals now. I will come closer to the camera because the sweet spot is between 0.5 meter and 1 meter from the camera. So using machine learning and artificial intelligence, the camera gets my face. And after 8 seconds, it measures my heart rate. After 15 seconds, it measures my oxygen saturation. And after 30 seconds, it will measure the amount of breaths that I'm doing. The relevant area is beneath the eyes. So there is no problem with wearing headphones, glasses, beard, or a mask. The minimum screening is after the respiratory rate finishes is 30 seconds. So if you want to move forward more measurements, you will need 1 minute to get the stress levels and the heart rate variability, which will take 1 minute in total. The stress levels are measured using the Baersky mental index, and the heart rate variability is measured using normalized standard deviation. This application, our application, is running on the edge, so there is no need for internet connectivity. And also, our clients are the owners of the data, which makes Bina HIPAA and GDPR compliant, which is very important. When the measurement finishes, we get this report with the 5 parameters measured, plus the BMI, which is calculated using some parameters that I introduced in the beginning. Now, what I would like to show you is how I measure it using my finger. You will see me here in the camera. So we introduce this camera in the lower part of the app. So now, when I cover the right camera, because nowadays smartphones have more than one camera, together with the flashlight, and I start measuring, the same parameters will be measured in the same amount of time. So I will show you some parameters. I won't take much time, but it's the same parameters as before in the same time. This kind of measurement is very sensitive. So if I remove my finger, the measurement will automatically stop, which I will show it to you right now. I won't finish the measurement again. So this is our application. And right now, my colleague, Avi, will keep going with the presentation, if that's fine for you.
Thank you, Kevin. Can we have the slides back up, please?
Yes.
Thank you. If you can go down, 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 down. You can go to the next slide, thanks. All right, so right now, what we're looking at is we have the 5 capabilities that Kevin mentioned and demoed to you on the application. In the coming weeks, we will have blood pressure out at the end of this quarter, as well as hemoglobin level, we believe will be early in Q3, as well as the lipids. And later this year and early next year, we're looking at alcohol blood level, temperature, and we believe we can do blood glucose early next year as well, all through the same mechanism. So right now, in terms of the telemedicine market, there are various different categories that you can apply BINA's technology to, as you can see in the slide, different services, different types, and obviously specialists will also benefit from this remote patient monitoring, both before they come to the hospital and after surgery, for instance. Next slide, please. All right, so what you can do with telemedicine is, for instance, BINA can be used as a remote triage situation where the measurements can be taken before the patient actually arrives in the telemedicine consult with the doctor. That way the doctor will already have the results, also minimizing the time he needs to spend on patients. And then obviously during the session, the physician can also ask questions and deduce what may be causing certain issues. Next slide, please. So currently we already have regulatory approval class 1 in Australia and South Africa, and we are in the pre-submission phase at the moment with the FDA and CE. And as you can see in the slide, we're expecting to have this all over the line in the first quarter of 2022. Next slide, please. So just in terms of BINA, we're using signal processing technology. And just so you're aware, the technology does not have any issues with any of the different skin types that can be experienced around the world. And we already have 40 million end users across 100 different companies worldwide, including Africa, Asia, the Americas, Europe, of course. And we're in LATAM at the moment as well. Next slide, please. Okay, so this is part of the accuracy verification. We've had clinical tests in India, in the US, and in Canada. And as I mentioned, we have the FDA CE. And another to note is the PMDA, which we're expecting in the short term to be completed. Next slide, please. Okay, so when you're looking at BINA as a software versus a wearable, as we've already discussed, the software, it's really easy to use and it's very easy to distribute. And with BINA's white label solution as a part of any of your local solutions, it can be very, very effective and easy to be in touch with millions of people at ease compared to a device which does require a whole round of logistics and connection and, of course, maintenance. Next slide, please. So just in terms of BINA's uniqueness, there are various aspects, but one that I'd really like to focus on is data privacy and data security. So with BINA being a standalone SDK, what that means is the end user's data is secured with the solution provider. We have no access to this information, and all of the computing, which Kevin showed you, takes place on the device itself and is stored on the device. And when the solution provider would like to actually access it, they need to ping the SDK. So that gives you full GDPR and HIPAA compliance. Now, all of the data, as you saw, takes place during real time. It can work on any smartphone of an Android 8.1 Oreo and above, iOS 13 and above. We also work with tablets, laptops, and we do not do any benchmarking, so there's no need to put in an age, a weight, or a height in order to get a reading. And we also work with any skin color, gender. And please, can you go to the next slide? All right, next one, please. So we're going to discuss how BINA can be used effectively in a COVID-19 screening. You can go to the next slide, thanks. So JAMA, on the left-hand side at the top, you see JAMA conducted a scientific study on people that had COVID-19 and were hospitalized in New York City. And it was almost 6,000 patients. And they found that the people that had COVID-19 with an elevated temperature of above 38 degrees, that only 30% of them showed that, of all of the people that had corona. So now if you're combining the three parameters which you can capture with BINA's technology, being heart rate, oxygen saturation, and respiratory rate, then you'll find that we can give that to you in 30 seconds. You actually have a higher likelihood of detecting or flagging a potential individual that may have corona. And we're being used in this way with many companies around the world, also at the Hello Kitty theme park in Brazil. Sorry, not in Brazil, in Japan. They're using the Hello Kitty theme park. There's a kiosk with an Android tablet, and they're measuring this and providing the green light to people that actually meet the criteria, and a red light to anyone, for instance, if their oxygen saturation is below 95, or if their resting heart rate is above 100, it's a red light, no access. Okay, next slide, please. So this is just in terms of how the system would work with BINA as part of the telemedicine solution. And of course, what happens if someone has COVID? They obviously go into a quarantine. And how do you actually check up on that person if they have no access to medical hardware? So with the BINA software, you're actually able to detect this, how this is working for these people. And we have use cases in South Africa, for instance, with Momentum Insurance Company, where with their current life insurance policyholders, if they contract COVID, they put them on a 3-week program where they measure themselves 3 times per day. And if, for instance, their oxygen saturation drops below 95, they take action on the real-time data by sending a ventilator or an ambulance to that person's location immediately, because it is real-time data at the end of the day. Next slide, please. All right. So this is more in line with the COVID-19 post-pandemic employee and customer wellness app. So with the world also moving towards wellness, and obviously it is top of our mind, not only just in terms of health, but also mental stress. BINA gives you the ability to actually track this and monitor trends. And Sompo in Japan, what they're doing, because in mental stress is quite a large portion of their client base, and in Japan, it is by law required that the employer is aware of employees' mental stress. They're tracking this, and if they notice someone's trend line over a particular period of time starts to rise, they take action on the data by offering them a yoga coupon or massage therapy to assist them in dealing with stress, and actually personalize a program to help them. Next slide, please. Thank you very much for listening. And if you have any questions, please get in touch with either Kevin or myself, and we'll be happy to take things forward. Have a lovely day.
Muito obrigado.
Thank you, Mr. Allen. Now I'm preparing the next one, the presentation of TW Tech, a Brazilian company. Mr. Alisson Guedes. Okay, I'll give you the word just a second. We're preparing your presentation, okay?
Hello, good morning all. Good afternoon. My name is Alisson Guedes. I'm CTO of TW Tech Saúde. I'm really happy what I saw with you, Avi and Kevin. I think we are connecting solution here. Our company, next slide, please. Our company is one of the market leader in oncology segment here in Brazil. We are based in Uberlândia, Minas Gerais. We are specialized in software tools for healthcare, oncology, hospital, clinics, e-health, telemedicine, and remote patient monitoring. We has a kind of, not a kind of, but actually is a HIS system. We offer those systems to private and public sector. Our system, our architecture is based on a browser. It's basically a operational system, works in any device. It's a full-based solution, in cloud solution. Of course, because we are using the browser, we have those necessary safety protocols to be attended or in compliance of. As a functionality, we have camera, audio, chat, integrated, all functionality with the medical agenda, integrated with the medical records, and others visual resources. As a differential, we offer service inclusive intelligent chatbot to start the attendance, private consultation, direct payments in case of they should be paid before they start the consultation. Next slide, please. Our HIS system named InfoClinic. It has a collection of several modules. We can say that we can start in the mobile schedule. We offer the electronic health and medical records. That's basically offer of the system in the hospital, offering to change from the paper to digital platform. We offer the telemedicine as well, medical prescriptions, digital medical prescriptions. We can understand the electronic prescription as well, and offer a pharmacy integration. Next slide, please. Over here, we have a lot of regulations, and we should be in compliance with those regulations. LGPD, that's the GPR. It's compared to the GPR in the Europe. CFM is the agents that regulate the sector, the medical sector here. It's a kind of this. And next slide, please. Our achievements. We have kind of 90 clients in the private and public sector, plus than 35,000 users and 3.5 million of patients in our databases. Next, please. What do we want? basically strategic alliance, e-health monitoring. Maybe we can talk later, Avi and Kevin, because I think it's important to talk. Artificial intelligence, machine learning, and genomic analysis for oncology prescriptions. That the things that we are looking for. I think it's there is one more slide, please. Our main clients, São Paulo, o governo do estado de São Paulo, that's a big hospital named Darcy Vargas. Mário Gatti is another one. Unimed Campinas. Unimed is a kind of a healthcare operator over here. Cardio Vida is another company, Onco Clínica as well. Instituto da Criança, it's a public hospital over here. Next slide, please. That's it.
Thank you. Yeah. Thank you, Mr. Anderson. Thank you, Denilson. Well, the next presentation is Israel company, Eitan Group. Please, you have the word, Mr. Diego Amaya. Welcome.
Thank you. Well, good morning. I guess for courtesy with the audience, I will present in English, and the slides will be in Portuguese in case somebody is not fluent in English or sorry, in Portuguese. So I'm half and half. So it's okay if I present in English and the slides go in Portuguese? Teresa.
Okay.
It's okay?
Yes, it's okay. Go on.
Thank you. Next slide, please.
Yeah, because we're going to have both presentations at the land page, no problem.
Okay, so I am Diego Amaya, director for Eitan Group, responsible for Latin America. I'm based out of in North Georgia, beautiful sunny day today, responsible for all Latin America. Eitan Medical, sorry, I'm seeing kind of a gray line on top of the slides, so probably it's cutting a little bit the presentation. I don't know if you see it, but anyways, okay, there you go. We are Eitan Medical. We were founded in 2009. We are basically dedicated to where our mission starts basically with the care of the patients, innovation, and obviously develop all these technologies to benefit the patients. We are committed to support patients and more, as Mr. Gerson mentioned starting this presentation. Two things are happening in the world right now is that with the pandemic is quality is something important that the hospitals and the healthcare system is realizing is important. It's not only products to have products, it's to have quality with those and the responsibility to deliver with precision. So that is important. And technology obviously is important and capacity to have that technology around the world. That's what we are dedicated on. And that's what we're doing these days to expand our presence around the world. Part of that example is me with Latin America. And like me, we have a team of experts covering the whole world. These are the three platforms I will explain. What are those? Sorel, Sapphire, and Avocet. Next slide, please. We were born in Netanya, Israel. You see in the upper right, that is our headquarters in Netanya. For those remembering Israel, there you go, a nice picture of beautiful Netanya. We opened operations in California 2 years ago. That's where our Americas headquarters are. I reported to that office. And we have in Israel more than 200 engineers, PhDs, all dedicated to technology. We were born a small company, and we were represented by a big, large company around the world until a few years ago when they decided to go with their own technology, and we decided to launch our direct presence as Eden Medical now in the world. So a lot of technology, a lot of good, let's say, organic growth in our company. Now we are a company over 300 employees. The pumps are produced in Israel, and we have sets, a line of infusion produced in Turkey, and very soon in Mexico. Next slide, please. We have at this point much more of 200,000 infusion pumps around the world. More than 85,000 pumps sold in 2020 with the pandemic. That was kind of also like a spring for us to continue and give us that let's say, impulse that we needed to start again directly with our pumps and our technology. In Latin America, we have more than 3,000 pumps installed. Unfortunately, in Brazil, we are not there yet, but we are in the process. Millions of lines of infusion around the world, 26 countries, all the authorizations, FDA, CE mark in Australia, Canada, Mexico. Right now we are in Colombia, in multiple countries of Asia. More than 60 patents. That is important for us. So this is our mission and vision: R&D, regulatory, production, and partnerships. Next, please. These are the three platforms that we carry. Sapphire, this is basically the infusion pump that we have in the market, and we are commercializing. Actually, Avocet is a new technology that is coming. It's more portable, more affordable, and it has connectivity. It's a very advanced product to have a portable infusion pump for patients that need to have that quality of life. And the third platform is Sorel, is something that is coming. This is a disposable pump, basically the size of a Tic Tac box, and it's a new, very, very disruptive technology for infusion of advanced medications and biologics. Next slide, please. So these are the two pumps that or the Sapphire pumps that we have around the world. We have a multi-therapy that you will see the size is really small and really very efficient. And we have the epidural Sapphire pump that in some markets is required to have a differentiated color for epidural procedures. Next slide, please. If you see the proportion of the pump in the hand of the doctor or the clinician right there is a very small pump, very light. I would like to mention this in one moment that probably you remember when you go to hospitals and you see these infusion pumps next to the beds and some of the services. These are big boxes, in boxes that are basic volumetric pumps providing infusion, continuous infusion. This is really advanced, really differentiated, and I will tell you why. Is first of all, I try to think like a smart pump, like when you think like a smartphone, and this is a smart pump because it has the following. It has a digital display, it's touch screen, it has a range of work from 0.1 to 999 milliliters. That is basically what the market, what the pumps, what the competition in the market is offering. It's multi-therapy. So this very smart pump can give you continuous infusion, multi-step, parenteral feeding, intermittent, PCA, that is something that is really, really getting adopted in the world right now with hand bolus. And we also have for epidural, PCEA, that is control anesthesia, and with bolus too. But this machine also give you blood transfusion. Each of these therapies that you see in the screen here will have a capacity to memorize 10 protocols. Usually hospitals, or doctors, clinicians, nurses will have a service, will have that specific therapy that they are working on, and that will be storage in the memory of the pump. But in addition to this, we have softwares that where the doctors and nurses can upload up to 1,000 or more medicines and protocols. Has something that is very important. I talk about quality, is a precision of more or less 2.5% of variation in the flow rate. That is important because usually all pumps, good pumps in the market, leaders of the market at this point, they offer around 5 to 6% of variation. So 2.5% is a very critical aspect of this pump, because we will be able to offer this pump for very delicate therapies, like for neonatal, things like that, or for patients under morphine that say that variation may cause really bad things to the patient if the flow rate, if the variation is too high. So that is important. That will give us the opportunity also to work on, since this is a software, it will regulate itself in a certain average that you see there, 2.5%. The weight of the pump is less than 1 kilo, half a kilo, 0.5 kilograms, so very light, and something that is also new and differentiated. This pump alone can work by itself with battery more than 24 hours at this rate, 125 milliliters per hour.
Mr. Diego?
Yes.
Excuse me. Okay, you have 1 more minute. I'm sorry. Okay, 1 more minute.
Okay.
Sorry. Okay.
Next slide, please. Next slide. These are basically the lines of infusion that we offer with the pump for all these therapies. Next slide, please. Next slide, please. These are the therapies and the places in the clinical use that we can have in the hospital. As I mentioned, UCI, neonatal, we can have in the ICU, transportation, and ambulatory, all these types of use. Next slide, please. We have everything available, and you can access into our webpage, Eden Medical, including videos, training videos, and everything. Next, please. And next slide, please. And this is our contribution last year, part of it. This is something that we provided to the National Guard in the US. This is just California. We provided over there more than 6,000 pumps, but all over the US, more than 85,000 pumps. So that's my presentation. Thank you. If you have any questions, please let me know.
Okay, thank you so much, Mr. Diego. Now the presentation of a Brazilian company, CDP. Please, you have the word. Dr. Frederico Salomão. Welcome.
Good morning, good afternoon, everybody. I'm Frederico Salomão, pathologist and an administrative and technical director of CDP Lab. I would like to thank for this invite and can pass, please. Next. So, we conduct with ethics, safety, and reliability and technical excellence exams that aid in diagnosis and contribute to the quality of medical care. So in addition to diagnosis, every disease, mainly cancer disease, we can provide prognostic and predictive treatment data to our colleagues. Next. So our vision is to be recognized technically and ethically as the reference laboratory in pathology in Minas Gerais and Brazil. Here in our city, we are already the reference in private oncological pathology with the most complete range of services and the largest team and the largest casuistry in oncology. Next. So this is our values. Next. The lab was founded by Dr. Eliana in 1991. Since then, the lab has been growing, expanding the range of services. And in 2011, me and my mother, together with other members, growing the lab. And now we are a total of 4 pathologists team. Next. So we perform perioperative exams like frozen sections and prints, biopsy analysis, analysis of surgical specimens, conventional cervical vaginal cytology, fine needle aspiration punctures analysis, immunohistochemistry, and diagnosis reviews. Next. So the opportunities. The CDP holds an archive of paraffin blocks of about 30 years of casuistry, mainly in oncology pathology that can be used in medical research in a partnership with other institutions. So this database is rich in oncology cases and not yet explored. So it's a biobank for molecular studies that may be of interest for scientific research in the area and AR development. And we are interested in acquiring equipment and software technology in the area of pathology, like slide scanners with high resolutions and high speed scanners, and also developing experience in molecular studies of neoplasms. So next. Thank you for your time.
Okay. Thank you, Dr. Frederico. Thank you so much. Now we're preparing the next slide. Just a minute, please.
Maybe I can use my slides because I want to share the movie. It's possible?
Just a minute. Ele pode usar o slide too. Yes, you can.
Okay.
So
Yes,
you can do it. So now the presentation of Vitalater Israel company. Please, you have the word, Mr. Semi Elaloufi.
Thank you. Very pleased to meet you. Thank you for the invitation. Do you see the slides?
Yes.
Okay, I'm just in presentation. Okay, my name is Sami Elalouf. I'm heading the sales and marketing of Vitalater. We are as a young startup involved in the continuous remote monitoring and protection. So just a few words about the company. We have been established in 5 years ago, and we have launched our product in 2018. We had the idea about combining artificial intelligence, IoT, and cloud technology, cloud computing, in order to provide a solution to monitor patient beds. So we have developed a sensor that is simply mounted under the bed and start providing measurement and analyzing the movement in real time, and is able to send alert when something happens, something like a bed exit, for example, or like a heart rate not a good heart rate or respiration rate as well. So in that way, we can provide a very efficient tool for the nurse. And we have a simple way to install the system. So there is no computer in the hospital or in the nursing home, only a simple sensor on the beds, a Wi-Fi connections, and there's a dashboard that is can be either on a mobile device or on the computer. So in the next step for us is to develop solutions for remote monitoring at home. So in that way, we can, for example, if someone is discharged after surgery, he can be remotely monitored with our systems. It's very discreet, so there is nothing to touch. No, it's not intrusive. It's remotely monitored. Also for hospital at home, the service. So what are the benefits? We can prevent falls because anytime someone is leaving the bed, for example, during the night, we can prevent falls by alerting the nurse in advance that someone is going to move out of the bed. We can prevent pressure ulcer as well, because we are continuously checking the movement in bed. If the person is too static during a certain time, then we can notify the nurse to turn the body, to reposition the body in order to avoid any skin infection. We measure also the trends of the heart rate and the breathing as well. And we can see early deterioration and send an alert on time. The next step, what we are doing now is we are detecting epilepsy seizures, and also when the people is wandering in the corridors during the night. So we are developing now, we have started to develop a biopatch that can be put on the chest, under the chest, and measure other vital signs like core body temperature and oximetry, and of course can detect the fall when the patient is out of this bed. So I won't go over this, but I want to show you a real-time monitor. Just hold on. Do you see Google here?
Yes.
Do you see a table, Quattro de Mondo?
Yes, we can see.
So you can see, yes, you can see the slides. Let me show you a real-time one. Now you see, right?
Yes.
Okay, I can put it in a different language, so let's put in Portuguese. So here you see on real time, each block corresponds to a bed. And the bed is allocated, is attached to a room and the bed number. Okay, so each block corresponds to a patient in bed. Here is out of bed, and that way you can monitor on real time the patient. So you see on real time the heart rate and the respiration rate of the patient, if he's moving in bed, if he's relaxed or stressed. And each resident, the care staff can activate or deactivate different type of alert, customize. For example, here, you can define the risk of the risk level of each patient, and the alert will be triggered according to these settings. Also for pressure ulcer, the system will look at if the patient is static or not static, and will send an alert. Also for falls, so very easy to set up and customize per patient. All the alerts are here, and each time there is an alert for fall, for example, the nurse can report about what's happened when she arrived at the room. So that's this monitor. We have installed it in our first reference in Latin America. It's in Panama, in a private hospital, and we are planning to continue our footprint, develop our footprint in Latin America, in different countries. And Brazil is a strategic one, of course. Any questions so far? Thank you for your time.
Thank you, Mr. Sami. Now the presentation of IMECAP, a Brazilian company. So please, you have the word, Dr. Henrique Pierotti Arantes.
Hello,
Welcome.
everyone. Thanks. It's a great pleasure to be here. I'd like to start showing a video, and after that, I will talk to you.
Yeah, just a second.
Okay, thank you.
Yes, there you go.
Thanks.
Toda grande história tem um começo. Há 19 anos, o IMEPAC Centro Universitário chegou a Araguari com o objetivo de oferecer cursos superiores de qualidade à região. Atualmente, são ofertados 23 cursos, referência nacional e nota 5 pelo MEC.
A educação é o nosso negócio. Para proporcionar uma verdadeira transformação social, resolvemos fazer mais. Ampliar o espaço da sala de aula e conectar os conhecimentos construídos na melhoria de vida das pessoas de Araguari e da região.
Hoje, o IMEPAC desenvolve 33 projetos que conectam estudantes e professores à comunidade, principalmente aos que mais precisam de apoio. Os cuidados começam com projetos bem diversificados na atenção à criança e ao adolescente e se estendem até a terceira idade, incluindo o apoio a diversos projetos sociais da cidade e até na África, sempre prezando pela inclusão e acessibilidade e pela promoção da diversidade, direitos e valores humanos. O Núcleo de Práticas Jurídicas, por exemplo, estende serviços e orientações aos cidadãos, bem como a clínica veterinária, que presta atendimentos ambulatoriais e cirúrgicos, incluindo castração e ultrassonografia.
Todas as nossas ações, independente da área, estão amparadas por uma estrutura de ponta.
E é visando a qualidade de vida da comunidade que o IMEPAC possui um amplo leque de serviços na área de saúde. O centro ambulatorial presta atendimento médico 100% gratuito. São 35 especialidades, exames diversos e atendimento nutricional e psicológico. Mais de 95 mil pessoas já foram beneficiadas. Os ônibus do Expresso Saúde complementam essas ações. Equipados com consultórios médicos climatizados, eles levam saúde e informação aos bairros mais distantes, distritos e cidades da região, chegando a quem mais necessita.
E nossa história continua em processo acelerado, com as obras do Hospital Universitário Sagrada Família. Nossa maior missão é continuar a oferecer ensino de alto nível, sempre cuidando da saúde de todos. E com vocês, faremos muito mais.
Okay. In name of our dean, Dr. José Julio, we'd like to thank this opportunity. My name is Dr. Henrique Arantes. I'm the coordinator of the medical course, and I'm part of the board of the Simulation Center. So in the next few minutes, we'll talk about simulation as a keystone of patient safety, medical education, and healthcare. So our med school is a national benchmark. We are exclusively affiliated with Harvard's CMS, Center for Medical Simulation in Boston, and IMEPAC uses cutting-edge technology to foster education, excellence in education. We have the previous one, please. Okay, thank you. We have the biggest, the largest simulation center in Latin America. As shown in the video, we have our patient center with over 30 medical specialties, and IMEPAC is building a new hospital with over 300 beds, the Holy Family University Hospital. And the idea is to have innovative ways to learn and to improve healthcare. So as a football team, we need to rehearse and simulate many things. Next one. So we know by literature that at least 1 in 20 patients will be affected by preventable patient harm in medical care settings, and approximately 12% of preventable harm causes permanent disability and patient death. So we need to change this game. Next one. We know by research that one study estimates that in the United States, medical error can be the 3rd leading cause of death. So in many countries, it can be even more than that. Next one. So as the football team, the soccer team, I told you, we need to rehearse and train a lot. So we use simulation-based education, not only to integrate cognitive, technical, and behavioral skills into a realistic environment where students can engage and can safely mistake and learn with this situation and from their mistakes. The primary goal is not only working technical skills, but also teamwork and communication skills, especially because communication skills are one of the most important cause of errors. Next one, please. So I'll show you in the next few slides some photos of our new sim center. So next one. So we have many equipments. We have intubation room, room for training of chest compressions. We train many skills with our med students and also with our healthcare team. We have a simulated ward with 12 beds, and we can provide care in this simulated environment, not only for technical skills, but also crisis resource management principles to be applied, teamwork and communication skills that are so important for healthcare, especially in this pandemic world we live nowadays. Next one. So we have a pre-hospital area, and this is an engaging setting. We have an ambulance, and we can train our students and healthcare professionals in this setting. Next one. So this is the site of the Center for Medical Simulation, harvardmedicine.org. This is the simulation center we are affiliated with exclusivity, and the idea is not only to provide faculty development, but also transfer of technology, cases, and other important steps to transform simulation in an important tool for learning. So simulators are part of the process, not the most important one. So we have to test and train process. Next one. And we had this ceremony in 2011 in Boston for celebration of our CMS affiliation. Next one. And we had this course simulation as a teaching tool, the SATT course. This was the first course in English version in Latin America with faculty from Harvard Medical School and MIT as part of this course. Next one. So simulation will be at the heart of our university hospital. This will be a way of creating learning and fearless organization. These principles are crafted by Amy Edmondson. We train a crisis resource management, not only for technical skills, but also for non-technical skills. We want to train teamwork, aiming to increase not only patient safety, but also employee well-being, which is very important, especially because the amount of burnout in healthcare professionals are increasing steadily during this pandemic time. Next one. So in this innovative way of learning, we will perform a simulation testing in July of this year, and we'll have some institutions participate in this project. So from the United States, we'll have the Center for Medical Simulation, and from Australia, we'll have the Matter Education, which is one pioneer company with this approach called OptiSim. And we'll have our university hospital as well in EPAC performing this test. Next one, please. So for this sim testing, we have some testing objectives to identify latent safety threats. We have some team objectives, especially to foster a sense of belonging and to a new hospital culture linked to simulation, and we'll have some institutional objectives, especially to increase patient safety. Next one. What we wish is to import virtual reality device for education, mannequins in test trainers for simulation-based education, medicine, hospital supplies and equipments, diagnostic image solutions, robotic surgery, and telemedicine. What we wish to export, knowledge exchange, interchange. Next one. So areas of cooperation, partner with companies developing virtual reality for education purpose and simulation-based education, search for quality and innovation regarding hospital and technological resources, partnering with company aiming to use machine learning and artificial intelligence in hospital, and student exchange program, not only for faculty, but also for students as well. Next one, please. So thank you so much for your attention, and let me know if you have any questions.
Okay, thank you, Dr. Henrique. Well, I'm really impressed with all these great health technologies that you presented. Our congratulations to you all. Now we are open for questions and answers. Remembering that we have all this material at the land page, okay? But we're open for questions and answers. No one? Okay.
I have one.
I have one question to Binar. Have you been developing research in artificial intelligence in pathology, oncology?
Então, como que você quer falar? Se estão fazendo isso especialmente para oncologia?
In oncological pathology, like analysis of slides, diagnosis of cancer, predicting data.
Right. So right now, the parameters that we have is the ones that I showed during the demonstration. And we are about to implement new ones, but we don't have in our roadmap parameters for oncology, specifically speaking. If that answers your question.
And T-double.
De novo, por favor.
And the T-double team, where is the question for T-double?
Do you prefer speak English or Portuguese?
I'm sorry.
The same question for T-double.
I'm sorry. I couldn't hear the questions. Can you repeat, please?
Have you been developing anything in oncology, pathologies in the area of ER?
We have a kind of flow of process questions to orient the treatment. But at this point, there is no artificial intelligence to decide with the best treatment. We are starting an integration with MEMED company that can decide which is the best treatment to be done or to follow. But at this point, we have no intelligent artificial intelligence flow for the best treatment in our approach. But we are working at this point with MEMED's company.
Thank you.
Else? Well, I would like to give the word to Coronel Vinicius. Would you share with us something, Coronel?
Oh, I thank for us, for everybody participate in this meeting. I hope next month I will arrive in Uberlândia again. I come back to Brazil next month. Thank for everybody this presentation and this opportunity to stay together, and I hope these next steps continue in the future. Thank you so much for everybody. Thank you.
Well, thank you, everyone. We will have a spot about this project at MG TV. Thank you, Rogério, for that. You know, we're going to have some news about this. So that's it. Thank you, everyone. See you next time. Thank you, all this team.
Congratulations. Thank you, Teresa.
Thank you. Thank you. Nice meeting you.
Thank you.
Sylvia,
Thank you, everybody.
would you like to say something? Just bye? Okay.
Rogério, permanece. Rogério, fica aí, por favor, Rogério. Eu falo com você.
Oi, general.
Falar com você.
Ah?
Só com informação, o Vinícius está terminando o tempo dele aqui. Agora, dia 29, ele passa a função dele. Dia 30, já volta para o Brasil. 30 ou 1º de julho agora. Tá? Só para você saber. E vai passar em Uberlândia aí também. Ele que é um grande incentivador essa iniciativa do Inovando Uberlândia, que nós tivemos hoje mais um round, e vamos ter outros também. Só com informação a todos.
Obrigado. Obrigado.
Ok, uma ótima semana a todos.
Bom dia a todos. Obrigada.
Bom dia.
Bom dia.
Bom dia.